Our first order of business, we're going to recognize Mark White to give us a presentation on DAC. And I'd also, do any of my co-chairs have any comments? All right, thank you.
Thank you, Mr. Chair. Good morning, everyone. And again, my name is Mark White, Fiscal Research Division. Welcome back to the joint meetings of the Justice, Public Safety, Appropriations Committees for the House and Senate. We are continuing our series of educational presentations this morning with a presentation on the Department of Adult Corrections budget. We're going to be going through the general budget for the agency, as well as digging into the different divisions. We do have, as we noted last week, a bit of a condensed schedule this year, and so we will not, some of the details here, DAC is an extremely large agency, and so there may be some details that we might have to not go into as deeply as we might otherwise if we had more time, but obviously staff are here to help answer questions, and there also are some folks who are actually from the department here with us this morning who can help answer questions as well. We like to try to keep things in context when we're talking about the various agencies in the JPS portfolio. You can see DAC here. You've seen this slide before, or a version of it, where we sort of highlight what part of the budget we're talking about. We're talking about DAC this morning, which does make up about 50% of the total portfolio in JPS. Total budget, depending on how you want to slice it, looking at expenditures or looking at net general fund appropriations, is right around $2 billion, with 18,524 FTEs supported by general fund dollars, as well as some additional FTE that come from other in other budget codes, such as the Enterprise Fund Code for Correction Enterprises and some of the special funds. In 2021, DPS and DAC were separated by the budget bill passed that year. That took effect in January of 2022, and so the department has now been independent for about 3 years. The current secretary, or acting secretary, is Leslie Dismukes. The DAC consists of prisons, community supervision, health services, and rehabilitation and reentry. Personal services make up about 64% of the budget at DAC, with a substantial portion going toward purchase services and 10% going to supplies. This slide here shows the expenditures by function, trying to divide the various functions of DAC into different pots. This roughly scans with the divisions at DAC, although I would note that DAC has between changes in leadership and becoming an independent agency, has shifted its organizational structure around quite a bit in the last few years. So this is, as always, subject to change in terms of what goes in what pot, but it should give you a vague idea of where the money is spent at DAC. Prisons, institutions represents about half of the DAC budget. Health services represents about 25% of that budget, with community supervision, which is for probation and parole officers, coming in third. Support services also includes food and nutrition. That's a small change from previous years. That used to be included under prisons or institutions. And the smallest programmatic area there, cut off slightly, is rehabilitation and reentry. And the small sliver of blue you can see there is for the boards and commissions, which make up a very small portion of the overall $2 billion budget at DAC. We like to talk about context, as I said, and thinking about DAC as a whole. There are over 100,000 individuals that are under supervision at DAC, 31,801 in the prisons, and that's as of January 31st. And so prisons are a constant, and community supervision for that matter, is a constant churn. There are folks that are entering the system and leaving the system every single day, and so getting an actual, this is how many folks are in the prisons number, you basically have to pick a date and sort of stick with it, and January 31st is where we're going to peg that number for most of this presentation. So 31,801 in prisons and 75,857 in community supervision. If you were to take this total population of those combined, it would be the 11th largest city in North Carolina, coming in between High Point and Asheville, and would be the 28th largest county, coming in between Moore and Craven. So with some of that context, we'll dive in to institutions. This slide has a lot of information about the different facilities in institutions at DAC. There are 53 state prisons, 2 current confinement and response to violation facilities that are currently up and operating, and 1 contract prison, which is a 30-bed residential facility for transitional housing for women who are still incarcerated. You can see on the map on the right-hand side the 3 levels of custody: minimum, medium, and close custody. Although you'll also notice that a large number of the facilities are multi-custody facilities. They contain various levels of custody within them. Close custody is the highest level of security. Close prisons typically have single cells and are divided into cell blocks. The cell doors generally are remote controlled from a secure control station. Whereas in medium security facilities, they consist primarily of secured dorms that provide housing for up to 50 inmates each, with group toilets and shower areas, as well as sinks and military-style double bunks and adjacent metal lockers. The minimum security facilities consist of non-secure dormitories that are routinely patrolled by correction officers, also with group toilets and showers adjacent to sleeping quarters, and generally a single perimeter fence, as opposed to having guard towers, continual patrols, and so forth. The breakdown on the left-hand side, the bottom left corner there, of the population between the 3 types of security, you can see that there is a plurality of offenders who are in medium custody, with minimum custody coming in just over 10,000 offenders, and close custody at about 5,600. So across all of those facilities, there are 38,302 beds. And as we said, we've got about 31,000 offenders who are currently in the system. Not all of those beds are in use at the same time. DAC measures their operating capacity based on their current staffing levels, as well as the needs of the population that they have at the time. Standard operating capacity refers to the number of general population offenders with 1 offender per cell in single-cell housing facilities, or in dorm-style housing facilities, the number of offenders who can be housed in each dormitory while allowing 50 square feet of living space and 25 square feet of day room space per offender, with no bunks in the center aisles and at least 32 inches between the bunks. If you do that with current facilities that are open and available, that puts standard operating capacity at 30,437 beds. Expanded operating capacity refers to basically condensing that space, providing a little bit less space per offender, perhaps putting more than 1 person where appropriate in cells, and if you do that, they can move to expanded operating capacity of up to 34,979 beds. The facilities, again, are not all entirely up and running at this point for combination of maintenance and staffing needs or staffing reasons. 25 facilities are fully open, 31 are partially open, and 2 have temporarily suspended operations. Slide 10 here shows the DAC institution's budget by function. We've been using tree maps for a lot of these types of comparisons, and in this particular case, I felt that the custody and security code was simply taking up so much of the space that a good old-fashioned pie chart made more sense here. Custody and security makes up 84% of the authorized budget for the institution's division at DAC. This is not surprising because custody and security accounts for 64% of all the FTE at DAC, and personal services accounts for 91% of the costs in custody and security. So you can see how that would eat up most of the budget. Other areas in institutions include the clothing budget, the State Misdemeanor Confinement Program, or SMCP, which we'll talk about in a little bit. That support services code and division includes food and nutrition, as well as building maintenance. Slide 11 shows the average daily cost by custody level over the past 5 years. You can see that about 5 years ago, we had an average daily cost, which I would note this includes a number of indirect administrative costs and direct costs. But 5 years ago, we were sitting at $128 on average per day across all 3 custody levels. And the cost today is now 151, or for FY 23-24, I should say, excuse me, is now up to $151 per day. However, if you adjust for inflation, $128 in today's dollars should be 157, and so they are actually coming in under inflation for these average daily costs, although they continue to rise in real dollar terms. Slide 12 shows a chart from the Sentencing Policy and Advisory Commission, looking at their prison population projections at the end of FY 23-24. The solid line shows the actuals in terms of average daily population for the prisons. You can see the COVID dip there in 2019, 2020, and 21, which has slowly risen since that point in time. The dotted line, that is the smaller dots, represents the standard operating capacity level, and then the thicker dotted line is expanded operating capacity. And so on current projections from the Commission, the projected prison population is not expected to hit that expanded operating capacity mark until sometime after the year 2030, indeed close to 10 years from now. So for a long time in the state, there was concern about capital needs for the prisons and whether or not there was enough. Based on current projections, capital is not the problem. Making sure that there's enough staff to adequately staff the facilities might be another matter, but the actual buildings themselves, there are enough beds to meet the need. There are 5 types of ways that an offender can enter prison. The most prominent and probably most well known is direct admission. In FY 23-24, out of the 20,781 total entries, there were 11,153 that came from direct admission. Probation revocations was the second largest amount, which is perhaps what it sounds like, the activation of a suspended term in response to a violation. Post-release revocations is the re-imprisonment of an individual who is on post-release supervision. Every offender who leaves the prison system goes on between 9 and 12 months of post-release supervision, and so if there are violations of that probation during that time period, then they can be sent back to prison. Individuals could also be sent back for the CRVs if they are put in the confinement response to violation facility more than twice, then their probation can be revoked and sent back to prison. And also there are safekeepers, which is a program where individuals who have either medical needs or pose a danger to themselves or others, if they were to stay in the local jail, need to be transferred to a more secure facility or to Central Prison Hospital, and so those individuals are sent into the prison system that way. I mentioned that FTE makes up a very large portion of the institution's budget, and so we'll talk about correctional officers here for a minute. Correctional officers have a salary schedule as of the 2021 budget bill based on the custody level at the facility and their years of service. They receive 6 weeks of basic correctional officer training at various sites throughout the state. And most correctional officers working in the division institutions are currently assigned 12.25-hour shifts. You can see the table here that shows the pay that's currently scheduled for this current fiscal year for FY 24-25 based on the years of experience there. CO1s are those that work in minimum custody, broadly speaking. CO2s work in medium custody. CO3s work in close custody facilities. Over the past several years, there's been a lot of discussion about the vacancy rates at DAC, and so we'll touch on that here. The current statewide employee vacancy rate is 20.1%. Inside DAC, it's a bit higher at 24%. In prisons, it's even higher at 28%, and then COs have a current vacancy rate of 35%. And since there are about 8,000 correctional officers in the system, those vacancies account for 73% of all of the vacancies at DAC. You can see the two tables here show the highs and the lows of the vacancy rates currently at the different facilities across the state. The highest vacancy rates are at Craggy in Asheville, at Granville in Butner, and at Pender in Bregaw. I would note, I believe that the issue in Craggy is tied to Hurricane Helene, but I think that facility was having some challenges as well, even prior to the disaster. The other table shows the lowest vacancy rates in Lumberton, Catawba, and Lincoln. The department has taken a number of actions to address these vacancy rates over the years. These actions, include, but are not limited to, continuous posting of these positions and same-day job interviews and conditional offers when they can be done. A sign-on bonus for correctional officers of $10,000 paid out in 12 equal monthly payments. And these sign-on bonuses are not limited only to COs. They also are for probation parole officers and other positions in the department.
I have a question for you, staff.
Yeah.
Chair. Thank you, Mr.
Yes,
Chairman.
sir.
Just before you get too far down the road, what is the population of inmates at those three where you've got those high vacancies? I mean, what is the population of inmates at those areas?
Thank you, Mr. Chair. Representative Pierce, I think I have that number, but not in front of me, and we can certainly get it to you. I believe that Lincoln in particular is relatively large, if I recall correctly, but we will we'll get that figured out for you. And again, I have those numbers, just not in front of me. Yes, sir.
Do we have any other questions at this point? Representative Pirtle?
Thank you, Mr. Chairman. I was just wondering if there was any correlation between the vacancies and the level of security at each facility. Are you having a tougher time filling the minimum or the medium or the close? Does that have any impact?
Thank you, Mr. Chair. Representative Pirtle, we will, I have those numbers and can perform that analysis. I believe that I'm looking to the department here too. I believe that close facilities in general might have slightly higher vacancy rates. But again, we can look at that and verify it for you. I don't want to tell you the wrong thing. Yes, sir.
Representative Cohen?
Thank you, Mr. Chair. With respect to, I understand Craggy, but with respect to Granville, which is my county, we also have the federal facilities there. Is that does the federal facility sort of cannibalize the potential pool of candidates that we have at our facility there?
Thank you, Mr. Chair. Representative, that is my understanding, yes. The federal facility, a lot of folks that might otherwise go into this field for the state rather wind up working at the federal facility. I had a question. Sure. Sir.
I have a question, actually. I think it was slide 13, talking about safekeepers. It's been a few years since I dealt with those, but if I'm not mistaken, the counties have to reimburse the state for the safekeeping. Are we making money off of the counties, or is it just a wash for the safekeepers? It's a wash. That's what I thought. Thank you.
So, right. So, in terms of current vacancy rates, steps that the department has taken, I wanted to mention the sign-on bonuses. As I said, there also have been some retention bonuses. There were initially a $5,000 bonus, and then in June of 2024, an extended current bonus. The bonus program was extended based on OSHR guidance. There also has been more efforts for career progression, including additional training and pathways to progress within the field. That also carries some financial incentives down the line. Overtime eligibility has been expanded so that lieutenants and captains and other ranks can also now receive overtime, as well as a number of facility hiring events and career fairs across the state. This high rate of vacancies has a number of impacts on DAC operations. We've talked a bit about bed capacity, and the high vacancy rate obviously has a large impact on the department's ability to fully staff and fully operate the facilities under their control. There also are greater demands for overtime because of these because of these high vacancy rates and low staffing levels. For example, in the last fiscal year, the actual overtime budget, the certified overtime budget, was $5.8 million. The actual spending on overtime was $67.7 million. And so that, of course, is paid for primarily with lapsed salary, as we talked about last week. You'll recall that lapsed salary is generated when agencies have positions that go unfilled for part of the year, and there are limited things that the agencies are allowed to do with that funding. Paying overtime is one of them. And so on the correctional side of things, the overtime piece is in some ways a self-correcting problem. If the positions could be filled, the overtime demands would go down, but it would have knock-on effects for other parts of the budget as well. And of course, it's not only something limited to correctional officers, although that is the largest piece. The table on the right-hand side shows the total lapse salary generated in FY 23-24 across select divisions at the department, the four sort of largest pots. 172.4 million from institutions, 31.7 from community supervision, 57.9 million from health services, and 7.7 million from rehab and reentry. All of that said, the department reverted about $10 million last year. And so of that amount of generated and lapsed salary, the department moved it around to cover various shortfalls like the overtime budget, like prison pharmacy, like health, which again we'll talk about those in a little bit, and wound up, when it was all said and done, with only about $10 million left over. So there's a continuing challenge in DAC between the budgeted levels and the reality brought on in part by these stubbornly high vacancy rates. Yes, sir. Questions?
I'm just gonna sit right here. You know, I'm a firm believer somebody works, they should get paid. But are we putting officers at risk by working them so much? I mean, are they working 7, 12s? I mean, are we putting them at risk by working so much? Are we putting ourselves at risk by letting them work so much? Can somebody from DSC answer that?
Good morning, I'm Brandy Shine Harris, Chief Deputy Secretary of Operations for Department of Adult Corrections. The overtime numbers, we would like to see them come down. So are you putting, is the facility at risk? Yes, it does create some long-term where employees are working long hours. We do try to get individuals to volunteer for it, but that doesn't always work. So yes, it's a difficult balance, and we try to do as much as we can to keep the overtime numbers down.
Thank you.
Mr. Chairman, is some of that,
Sir, Representative Pierce.
okay, is comp's time still in that mix of overtime? I mean, I know you get paid, but I've heard of some officers having comp time. It really couldn't take the comp time off because where we are, the department, is comp time still in play as it relates to officers who have just worked over and over and over? Is comp time still in play or not?
DSC.
So I'm Dr. Anthony Van, Chief Deputy Secretary of Administration for the Department of Adult Correction. And no, comp time is not in play with that. The officers are paid out every 28 days for overtime.
Representative Purtle.
Thank you, Mr. Chair. My question is on these vacancies. How long have we had extended vacancies within the organization? And part two of that would be is if we filled every one of them, would it create a pretty significant budget shortfall because they're using the lapsed salary to backfill unfunded budget request, I would take it. Is that fairly accurate? Or so we'll start with one. How long we had these salaries?
So, thank you, Mr. Chair and Representative Pirtle. So I've been a fiscal analyst with the General Assembly on the Justice Public Safety team for close to 9 years, and this has been a challenge that entire time. So I can't tell you how far back it goes, but I do think that the rate has gotten significantly higher in recent years than it was previously. It was used to be below 20, I'll say. But the vacancy rate was always a very real challenge there. And to your point about moving lab salary around, you're absolutely correct. If all the positions were filled, that would in fact create some holes in other parts of the budget, particularly on the medical side. At the same time, if something like overtime, for example, were budgeted at its current levels, and then all of the positions were filled, you in all likelihood would wind up with tens of millions of dollars that would revert at the end of the year because it was overfunded higher than it should be. So there's a sort of chicken and egg problem with the tied to the vacancy rates into lab salary and trying to make the budgeted amounts match the spending reality at DAC. And this was a problem even back when the department was part of DPS.
Representative Pierce.
Just one more question. I have a prison right in my, so I can go over there and get most information I need right there in Robert Scotland County. When they have the exit interviews, when they are leaving the department and no longer want to work, I'd like to know what's some of the reasonings that they are leaving. I know they don't have that prepared this morning, but I'd just like to know what is the reasons why a lot of staff is leaving. It's got to be a reason. I hear it all the time. They call me at home, but I'd like to know if it's in writing so this committee can also have a copy of why so many people are leaving corrections. Thank you.
Can somebody answer that, or you want to get back with us on it? Or you want to do it now?
Do I need to say my name again? Hi, I'm Brandy Sean Harris from Department of Adult Correction. We don't always get good information from the exit surveys. We try to get them to fill them out so we can see exactly what the cause is. Some they go to different agencies for better pay. We also see that they do leave because of the overtime, and so between the two combinations, those are the things that we are seeing on the exit surveys that's being completed.
Thank you. No, just thank you.
Mr. Chair.
Sorry, Senator Grassley.
Thank you. And kind of following up a little bit, I know there's been a lot of work done. There's the new salary schedule. I know that you all are constantly advertising and trying to analyze how to better, recruit and retain. I wonder if anyone's done any analysis about, what would be the dollar amount we would need to raise salaries to make a dent and to kind of reach a tipping point in terms of recruitment and retention. And I know that that's not necessarily going to be an exact science, but it seems pretty obvious we're not paying people enough to do the jobs. If you pay enough, people will do the jobs, right? So, I know there's no magic answer and we don't want to overshoot, but I'd just be curious if there's that sort of analysis being done.
DSC.
Dr. Anthony Van, Chief Deputy Secretary of Administration for the Department of Adult Correction. So, do we know a magical number? No, we don't. So what we can tell you is right across our mountain area in Tennessee, you've got Tennessee who's starting at 51,000, which is hurting us really bad because people just drive across the county line. You have county jails that are also paying at like 50,000 to start. So, do we know a magical number? They're still having problems recruiting even at those particular numbers, but it's not as bad as ours.
Follow up?
Really just a comment, I guess. Thank you very much for that. And I guess I appreciate, I don't know that you're never going to get a magic number, but I think it might be helpful if we, and I know you all make your budget requests and that's part of what you're looking for, but I think it would be good if we were able to at least know what we are not meeting so that we can try to figure out how to get there. So thank you, Mr. Chair.
Oh, I'm sorry. Representative Green?
Yeah, Mr. Chair, thank you. And you kind of touched on part of a question I had. are Tennessee, South Carolina, Virginia, other areas, are they experiencing the same kind of trouble that we are, even though it may not be as extensive? Are they having a hard time getting people to work?
Yes, sir. This is not isolated to North Carolina. This is a nationwide problem. When we go to conferences or just kind of talk to our coworkers in other states and stuff like that, this is not isolated to North Carolina. It's everywhere. Everybody's having the same problems.
Anything? All right. Representative Pierce.
Just wanted to bring up something that I get confronted with quite a bit. We've got a lot of great officers, believe me, but there's still a lot of officers, a lot of people who still run their own enterprise within those facilities, and because of that, it creates a lot of problems for people. And I wish that staff, at some point, you might just bring that on to your because it's going on, and we all know that, but it creates problems when you have people operating with their own business within those cell phones, whatever they're doing, and it creates problems. I mean, I can articulate it, but I know what the problems are because they call me all the time about people who are doing things. It creates problems. It creates problems. So I wish some way we can start having a conversation about that. We've got to find a way to stop that. I don't know how, but it's got to be a way to stop contraband from coming into our prisons because it creates problems. Thank you, sir.
I agree.
All right. So, thank you for the questions, everyone, and discussion of one of the issues that, again, has been a persistent problem in DAC for quite some time. Moving to other parts of institutional operations, some of the day-to-day life in the prison for the offenders. There were 35 million meals, give or take, served in this past year. 3 meals a day, 7 days a week. They issued 320,000 sheets and 132,000 items of clothing, including shirts, trousers, jackets, headwear, socks, shoes, etc. Facilities have barbershops that are staffed by offenders. There's a certification program that's available at Harnett Correctional. Facilities also have canteens available where additional products are available for purchase using the offender's trust fund account. There's a incredible range of products available in the canteens, including, but not limited to, beverages, condiments, packaged meals like ramen or microwave sandwiches, that sort of thing, personal hygiene items, and again, a host of others. Tablets are also a part of modern day-to-day life in prisons. These are installed at all prisons on a secure Wi-Fi network. Again, it is a closed, secure Wi-Fi network. It's not unlimited access to the internet. These tablets provide multiple services, including free apps for various certifications and other corrective programming through Hope University, system messages, and access to the law library. They also offer paid entertainment, music, movies, and that sort of thing. The contract with the company ViaPath is supported by those entertainment purchases, and so the tablets were not something that cost the state anything directly. It's supported by the offenders making purchases. There are a number of folks who work while they are incarcerated. The majority of those who are participating in work programs do so inside the walls of their facility. The largest work category are those who are in unit service, which includes janitorial and general maintenance duties, just over 5,000 offenders last year. Food service is the second highest category of folks working in the kitchens, preparing and serving food to other offenders. Correction Enterprises, which we're not going to have time to go into detail today, but is a large-scale manufacturing program across the different facilities in the state that performs farming, food processing, printing, sewing, laundering, manufacturing, including eyeglasses, road signs, license plates, framing, all sorts of different activities. Also, individuals work on prison maintenance teams, and the prison construction squads. For those who work outside of the prison, there are three options available. The road squads, who work under the direction of DOT employees, patching potholes, clearing rights of way, and picking up litter. There are also some contracts that prisons has with local and state governments for providing janitorial services and groundskeeping. And there are those who are on work release who are nearing their release date and have been proven trustworthy, and so they get some limited release in prison to go work for businesses in the community and receive prevailing market wages. It's about 829 individuals who participated in work release in the past fiscal year. I mentioned the statewide misdemeanor confinement program earlier in passing. Let's talk about that a little bit now. The SMCP houses certain misdemeanors in local jails who have a sentence that's greater than 90 days, and all offenders who are convicted of DWI. All counties participate in SMCP as sending counties, but not all counties participate as receiving counties. So anyone who's, regardless of where the person is convicted under of this misdemeanor that carries an active sentence, they could be sent to a different jail in the state, but not all counties will receive individuals who are participating in that program for a variety of reasons. County jails that and the jails that may have space are the ones that will be the receiving counties, as I said. Counties are reimbursed by the SMCP fund. This is funded with a recurring dollar amount at $22.2 million per year. Of that $22.2 million, the Sheriff's Association receives $1 million for administration of the program. DAC is also allowed to use $225,000 of that for administrative purposes, and the sheriffs are also allowed to use up to $500,000 for the inmate litter program. This is an optional program where if the sheriff elects to participate, they can bring some of their SMCP offenders out on litter pickup crews, and if they perform a certain amount of work, hitting certain metrics within a certain time period, then they receive a higher level of daily reimbursement for being a receiving facility. In 23-24, there were a total of 766 beds occupied across both male and females across the state, and a total of 963 beds available. So we're going to shift now to talk about community supervision a bit. This is the area formerly known as community corrections, but now using the term community supervision. You can see that most of the $254 million here is for probation, with 2,650 total FTE in this division. Probation includes probation and parole officers, chief probation and parole officers, field service specialists, and others. What's interesting and just worth noting, I think, is that community supervision, by design, sentence structured sentencing in the 90s and the Justice Reinvestment Acts about just over 10 years ago, these reforms have made it so that a number of folks who are convicted of lesser offenses serve their sentences in the community instead of going to prison. And so community supervision actually oversees about 70% of the offender population, but only consumes about 12% of the Department of Adult Corrections budget. That, of course, is because the average daily cost for community supervision is considerably lower. On the left-hand side here, prisons shows their average daily cost per offender for FY 23-24. Across all custody levels, it was averaged out to $151 per day per offender. Compare that to community supervision, where the average daily cost per offender is $9.36. There are other facilities or other programs that operate under community supervision that have slightly different cost levels. Transitional housing being the most expensive at $89.86. Community supervision, the community supervision additional resources at $10.13, and electronic monitoring and GPS at $5.41. Generally speaking, there are three types of offenders who are supervised in the community. They come from probation, post-release supervision, or parole. This chart here shows we're still waiting on a little bit of updated data here from Sentencing Policy Advisory Commission, but this is the most recent data available for the sentencing rate for by class of offense for individuals who receive probation. Probation, of course, is court-ordered punishment of supervision in the community. Class E felonies have an average rate of 43% of offenders who are convicted who then go to probation rather than going into an active sentence in prison. And at the other end of the scale, Class 3 misdemeanors, 84% of those individuals wind up on probation. You can see the average length of that probation in the column there as well. Class D offenses and higher all receive active sentences, and so they are not included on this chart. The second group of individuals who enter community supervision are those who are on PRS, post-release supervision. I mentioned this in passing before. This is a mandatory term of 9 to 12 months that is served in the community after the offender has been released from an active prison sentence. The final group are those who are on parole. This is the smallest group by far because as part of those various acts that I mentioned earlier for reform, very few individuals who are in prisons are actually eligible for parole. Slide 27 here shows entries into community supervision at those three levels we just discussed. You can see, again, that COVID dip that happened in FY 1920 and FY 2021, slowly rebounding since then, but on the whole, over the 10-year period, a 23% decrease. You can also see that those on PRS are down to about 11,000 or so, and these are rounded cases. I would note the parole number is between 500 and 1,000 every year, and so it doesn't, with this formatting, it's that's why it's just a small sliver there. But PRS is down to about 11,000 cases or so per year from its high of 13,000. General supervision is the biggest function within community supervision, provides the supervision of the offenders who are on those three types that we've been talking about. 75,857 offenders under supervision as of January 31st. And again, that cost of $9.36 per day. There are nearly 1,600 probation and parole officers, and that does not count the leadership structure above them. That's just rank and file that are supervising those 70,000 plus offenders on a daily basis. The PPOs have a variety of jobs to do, including placing offenders into the appropriate supervision levels through their risk and needs assessments, providing counsel, making decisions regarding treatment to offenders, and responding to offender behavior and to non-compliance with their parole or with their probation sentence. Excuse me. Probation parole officers also have a pay schedule that was established in FY 21-22 in that budget. PPOs, unlike correctional officers, must have a bachelor's degree, and so their pay scale does begin slightly higher. They have 8 weeks of basic training before they begin their shift work, and then 40 hours of annual in-service training, which does include firearm training. They have an 8-hour shift model with 4 to 12 evening shifts per month. The PPO vacancy rate, in contrast to the correctional officer rate, stands at about 11%, and so the PPOs have managed to maintain their staffing levels even in the face of some of the headwinds that other parts of this sector are facing. Under the Justice Reinvestment Act, which after 2011, the court can revoke probation for violations that commit additional criminal offenses or absconding, and so which might include a period of confinement in response to violation, which again we'll talk about in just a minute. But PPOs also have delegated authority, which allows them to impose certain additional requirements without additional court involvement when the offender has failed to comply with one or more conditions of the probation. And so there is a lot of discretion that PPOs have when handling their cases. Still, as mentioned before, there were about 6,500 or 6,600 revocations that resulted in a prison sentence in FY 23-24. I mentioned that PPOs are responsible for assessing an offender's risk level which determines their supervision requirements. Based on a number of factors, including court conditions that are imposed, behavior of the offender, assessed risk of rearrest, and their needs, they are divided up into risk categories. And then, depending on those risk categories, that determines the level of supervision that they receive. The L1 level here is the most severe, with L5 being the least severe in terms of the amount of supervision that is needed. So perhaps obviously the low risk and low need cases have more traditional probation strategies and they're bit less hands-on. And higher risk and needs cases have more rigorous individual plans, which may include contact in their home or work environments. You can also imagine that based on the number of times that probation officers need to contact the offenders and so forth, the higher risk categories do take up more time and therefore cost more money. And they also, the other important thing to note about these risk levels, is that they inform the caseloads that the PPOs will be carrying. The caseload standards for each PPO are reflected in this table. On average, a PPO should be carrying about 57 cases at any given time, but again, based on that risk level, with L1 being higher, L5 being lower, you can see that higher risk cases, if you've got more of those, the goal is for the PPO to be carrying fewer of those at any given time. The table on the bottom half of this slide shows the average caseload per division as community supervision divides the state up. With a real-world factor, they're adjusting for vacancies and for long-term absences to show how many cases each of the staff will actually be carrying at that point in time. The judicial service coordinators are also part of community supervision. When these positions were established, the goal was to try to get PPOs out of the courtroom and back out on the streets with their probationers, rather than having to take up time at the courthouse. So these judicial support coordinators are liaisons that process offenders from court to probation. They do offender education about what the conditions of the probation are, and assign an offender to the PPO. There are 220 FTE in this category, and the budget is about $13 million. I've mentioned the CRVs a few times now, so we'll talk about them here briefly. These facilities are the confinement and response to violation facilities. These are behavior modification centers for probation violators. For felons, the CRV period is a flat 90 days. For misdemeanants, the CRV period is up to 90 days when there's a violation of their probation. There are currently 2 facilities, one in Robinson for men and one in North Piedmont for women. The Burke CRV is temporarily closed due to staffing and demands. The total budget for the CRVs was $14.7 million and 85 FTE. So moving from community supervision to health services. The health services section provides routine outpatient care in 55 facilities across the state and inpatient care at Central Prison Hospital and at North Carolina Correctional Institute for Women, both located here in Raleigh. External providers are under contract and can provide medical care at a negotiated rate, and some other non-contract facilities agree to a legislatively mandated rate. This rate is set at, again by legislation, set at 70% of billed charges or twice the Medicaid rate. Other services offered by health services include behavioral and psychiatric services, alcohol and chemical dependency treatments, dental services, and pharmacy. Slide 37 here shows the breakdown of the actual expenditures in FY 23-24. You can see that most spending went toward general health, with pharmacy taking up a large portion of their budget as well. In calendar year 2024, DAC conducted 1.4 million health encounters, which included just under 700,000 nursing encounters, 418,000 medical provider encounters, 170 psychology and social work encounters, 40,000 psychiatry encounters, and 88,600 dental encounters. Of those, 98% occurred within DAC facilities, as opposed to occurring elsewhere. That remaining 2% were conducted in community medical clinics and hospitals, most of them for surgical or other interventional procedures. On the right-hand side of the slide, you can see some of the spending challenges and budgeting challenges that I alluded to earlier when we were talking about lab salary, that the certified health expenditures, net general fund expenditures for FY 23-24 was $370.1 million. The actual expenditures were $418.3 for an overage of $48.2. But again, all told across the department still wound up with about $10 million that reverted. And so, on the one hand, this budget does not reflect the actual spending needs. On the other hand, because of lab salary, the agency is able to continue operations and winds up with additional funds to return to the general fund at the end of the year. This slide shows the last 5 years of inmate medical expenditures. They've increased by 36% since FY 2019-20. That is not adjusted for inflation, however. That's just in real dollars. If you do adjust it for inflation, it's more closer to 12%, which is still 12% higher than inflation, but does match more closely with cost increases across the healthcare landscape.
Senator Grafstein.
A quick question, if you don't
Yes,
mind,
ma'am.
Mr. Chair. Is this, if you know, is this a function of the aging population in the prisons?
Yeah, thank you, Mr. Chair. Senator Grafstein, I have a slide on that coming up in just a minute. If you don't mind, we can get to that. That'd be great. Thank you.
Also, I have one question. Did we, and I'm sure you did, DAC, address the issue of having to transport inmates so far for health care services, like the issue that arose last year? You can answer that.
Thank you, sir. I'm Dr. Arthur Campbell. I'm the Chief Medical Officer and Chief of the Division of Comprehensive Health Services for DAC. The short answer is yes, sir. We've done everything we can to accommodate that. I think the issue is that if we're sending our patients out to the community, they're competing with the same resources that the community is to see those providers. And so it's a balance between making sure we meet their healthcare needs and at the same time try to keep it as proximal to the prison as we can. But it is a tough balance, and at times we do have to transport offenders, depending on the specialty, further than we would like to, depending on what's available in the prison they're at.
But when you're having to transport those, you're not taking high risk back to their home communities as like what happened last year.
Oh yeah, yes, sir. So whenever possible. So it really has to be a combination effort between our medical record staff and the officers at the facility, because the officers really know that piece of information more than we do. But there's a constant daily accountability. These patients are scheduled to go here, and there's that review that occurs. So we're making every effort we can to make sure that happens.
Thank you.
Yes, sir.
Senator Daniel.
Thank you, Mr. Chair. Mark, on the slide 37, it shows mental health expenses of $45 million. Is that, out of just is that services we're contracting for outside hospitals, or what's the bulk of that?
Mr. Chair, thank you, Mr. Chair. Senator Daniel, the information I've been provided suggests that 98% of all of the interactions shown here occurred within the facilities. There are some telemedicine encounters, but all of 13,500 of those, but that's not just for mental health, and that's that's within the facilities.
Follow up. So is that for personnel that are mental health personnel that we're paying for in the prison system? Does any of it include pharmacy overlap? I guess I'm wondering, where does $45 million go?
Mr. Chair, we can see if the department can answer that, but we can also look into that to see what the overlap is between the different budget funds.
Dr. Campbell again, sir. Could you clarify between the mental health and the pharmacy? What was the question?
Well, I guess I'm just wondering, like, if the mental health, where is $45 million going for mental health? Is it going to internal personnel? Is some of it medications? Is it external visits to, psychiatrists at UNC Hospital, or, where?
Yes, sir. So I would say with our mental health, so we are incredibly well staffed with both psychologists, social workers, and psychiatrists. We mentioned the telemedicine. All of the psychiatrists that primarily do their work virtually are employees. They may be hired through a contract, an individual locums provider, but they're provided in-house. We very seldom have to send anyone outside our walls for mental health care. But those are mainly for the staff. Psychiatrists are quite expensive to hire.
So I guess not to berate this, so just Mark. So I guess if you could just find out, is of that $45 million, is it mostly personnel, or?
Yes, sir. We can find that out.
Yes, sir, because their pharmacy costs will be included in the overall pharmacy costs if you're looking at that piece of it. Yes, sir.
Representative Green.
Yes, thank you, Mr. Chairman. And just to kind of piggyback on what Senator Daniel was talking about, do we capture of this 45 million up here? How much of that? I expect part of that is substance abuse treatment and so forth. Do we know roughly what percentage of that 45 million is in substance abuse versus other psychological disorders?
Yeah, so thank you, Mr. Chair. Representative Green, we'll do some follow-up on that, but please note that ACDP, I'm sorry I didn't explain what that was. That's alcohol and chemical dependency programming, is what that is there. So there may be some overlap between the two categories, but we'll get the exact response for you.
Representative Pirtle.
Thank you, Mr. Chairman. Since my colleagues opened the door, I have a question too concerning that line item. Because I was looking on line 36 and we was talking about when you was giving services provided, alcohol and chemical dependency treatment, and the cost associated with that. I know that there's a revenue stream coming as a result of these opioid settlements, and the state is getting a large chunk of that, and it's designated just for that. So I'm wondering if we're designating that revenue stream from this settlement from the state share to address the issue that it was designated for, and instead of just using tax dollars, that we're addressing it with that particular revenue stream. Thank you, Mr. Chair.
Sir. Thank you, Mr. Chair. Representative Pirtle, again, we can get more details on that for you, but my understanding is that most of the settlement is running through the Department of Health and Human Services, as opposed to running through DAC. And so while there might be, I think it is going for those purposes, but it is going through DHHS rather than going through DAC. There may be some overlap in the programming, but I'm not sure. We can find that out for you. Sir.
Representative Pierce.
I just had a concern. It's sad that some of our veterans are part of guests of our state in the Department of Corrections. If they come with issues, are we allowed to let the VA take care of those issues, particularly with medicine, seeing the doctors? I just thought about that because I know, sad, we do have some veterans in our system, and if they're already receiving health care before they come to the facilities, do we reach back out to the VA to say, look, this veteran had problems and due to different reasons? I'm just concerned, just a thought that came to my mind about sometimes we have veterans in our facilities.
Representative Pierce, I've looked at the department to see about for the VA in particular, and we'll hear from them in a minute. Related potentially, and it may work the same way for Medicaid payments. If a person is enrolled in Medicaid and they are outside of the walls for 24 hours,
Yes, sir.
For a procedure, then Medicaid can be billed. But if the procedure does not require more than 24 hours outside of the facility, it has to stay as a cost with DAC. One thing that has happened from Medicaid expansion is there are renewed efforts to try to get individuals who might be eligible enrolled before they are actually discharged from the prison, so that there would not be a loss or a drop in their coverage once they go back to the community. It's possible the VA works the same way on that 24-hour rule, but I'll look to the department, see if they know, and if not, we can get back to you with that answer.
Thank you.
Any more questions? Okay, Mr. White.
All right. So we were talking about some of the cost increases over the past 5 years. And just one other final note here. It's kind of tough to see, but in general, the ratios between those four categories have roughly stayed the same, although general health has creeped up by about 2%, taking 2% more of the share of those costs over this time period. So as Senator Grafstein noted, there's a number of factors causing this, including an aging population, which we'll talk about in just a second. National increasing costs of healthcare are helping drive this. Offenders often have a care deficit when they arrive at the prison with untreated pre-existing conditions. Inmates may sometimes seek health services for secondary gains, trying to break the boredom of their daily life in the prison. The offenders are also more likely to have communicable diseases, such as HIV or AIDS, hepatitis, and tuberculosis. And of course, mental health and substance abuse are more common in the offender population. On that communicable disease front, I think there's been a development in the past few years that's worth having a brief aside on, and that's about hepatitis C. So, excuse me, as you may know, there was a medical breakthrough in the past several years in terms of hepatitis C treatment, where there are now drugs available that can really make substantial progress against the disease, and effectively curing it, is my understanding. And so there was a question about who would receive that treatment in the prisons. There was a lawsuit about this topic, and in 2020, DAC entered a court settlement tied to hepatitis C. At the time, DAC was using an objective criteria or risk stratification strategy for prioritizing who was going to receive these very expensive drugs by testing individuals who were showing symptoms or were at high risk. Under the settlement, while not every offender now has to be tested, DAC does have to offer testing to all offenders at multiple points during their incarceration and repeatedly screen and educate offenders about the risk and treat them for it, regardless of what their where they might fall within that previous risk stratification system. So in 2019, prior to the court settlement, DAC expended about $4.6 million on hepatitis C treatment. In 2024, DAC was billed $36.5 million for hepatitis C treatment. However, because of the 340B program resulting in lower pharmacy costs, they were able to cost avoid $11.1 million of that, and spent $25.4 million on that treatment. However, it is still $25.4 million in treatment of something that previously was $4.6 million, and so it really is having a huge impact on pharmacy costs. Last year, that treated 1,725 offenders, which works out to about $14,700 per offender for the hepatitis C treatment. So this is just one example of some of the challenges that face the health services division with costs. The aging population that we've talked about, this shows it over the past 10 years. The group of offenders who are over the age of 60 about 10 years ago was around 5%, and it has basically doubled over the past 10 years. And so now we have fully 10% of the offender population that is over the age of 60, and 2% of the offender population that is over the age of 70. And of course, as individuals age, they have greater healthcare costs and needs. Slide 41 here shows the certified versus actual expenditures for healthcare over the past several years, past 10 years rather. And so all of these factors, including the aging population, the large medical need of this particular population, the constitutional obligation the department is under to attend to offender conditions, and growing industry costs in general, have resulted in multiple years of cost overruns for health services, even after the General Assembly provided a $50 million infusion of recurring funding just a few years ago. The projected costs there for FY 24-25 for this current year show that this trend is expected to continue. Briefly talking about vacancies in health services, similar to how we were talking about correctional officers, nurses stand at 38% vacant in their positions right now. These are extremely challenging positions to fill. Persistent high vacancy rates have led the department to use more contract nurses or traveling nurses which are more expensive on a per capita basis. Nurse positions make up 38% of all the health services FTE, and so they're helping drive the higher than the department average vacancy rate in health services. Last part of health services to talk about here, alcohol and chemical dependency programming. ACDP division provides substance use disorder treatment, recovery, and continuing care through community-based residential treatment programs for probationers and parolees, prison-based intermediate programs, and long-term prison-based intensive outpatient programs. Two facilities that this section operates include the Drug Abuse and Alcoholism Rehabilitation Treatment, or DART Center, formerly known as DART Cherry for men, and the Black Mountain Treatment Center for women. ACDP has $16 million per year for all their program expenditures. The last section of DAC we're going to talk about today is rehabilitation and reentry. This division oversees a comprehensive array of programs, services, and resources to help offenders rebuild their lives and successfully reintegrate into communities. Most of the funding goes to the corrective programs side of things, with some funding going toward reentry services, offender education, and rehabilitation services. This slide shows a portion of the corrective programs that are offered in the prisons, including academic and vocational programs, family-oriented programs, religious programming, and personal growth and development programs. The availability of programming varies somewhat by facility, and access to it is dependent on custody level and on individuals' behavior within the prison. Offender Education Services, budgeted at $6.84 million per year with 67 FTE, provides educational opportunities, including basic reading, writing, and computation skills, all the way up to advanced vocational skills and life skills. There are three different program assignments within Offender Education. Academic programs provide incarcerated individuals with a sound basic education, reading, writing, computing, helping them pass the GED and acquire other survival skills. You can see the breakdown here with part-time enrollees and full-time enrollees for FY 23-24 for each of these three categories. Vocational programs provide programs like computer literacy, food service training, brick masonry, job readiness, and these work through the local community colleges. These programs also help incarcerated offenders obtain work with correction enterprises or with work release assignments. Finally, life skills programs, which are have the highest rate of enrollment of the three types of program. These include cognitive behavioral interventions, helping offenders restructure their thought processes with the goal of changing behavior that will ultimately result in less criminal conduct. I mentioned the DAC partners with the community college system to provide academic programming. This slide shows the total educational attainment degrees completed by offenders in FY 23-24, including high school equivalent diploma, college diplomas, Associate of Applied Science degrees, and vocational certificates. DAC partners with 43 community college institutions across the state, offering this programming in all prisons. Many prisons also have dedicated classroom space for these programs. The Treatment for Effective Community Supervision program was created under Justice Reinvestment Act. It's a series of contracts for community-based services focused on evidence-based practices aimed at reducing recidivism. It has three core programs to it, which we'll talk about here in more detail. The Recidivism Reduction Services, or RSS, is a provide vendor-based social services. It's the largest program under the TEX umbrella. All the referrals to this are generated through the automated process in the offender case plan as part of managing each offender's case. The eligible pool of offenders for our RRS programming is the population of offenders in each county who've been assessed at different terms of their suspension level. But due to limited funding, the pool of eligible offenders is sometimes limited. This programming includes cognitive behavioral intervention therapy and other therapies, a continuum of substance abuse services, education, job training, and other services. Again, these are performance-based contracts that have an average of $3.8 million per year in terms of their payouts in FY 22-23. The latest annual report for the TEX program is due soon, and so we will have updated numbers on this for anyone who's curious when that report does come out. The second big program within TEX is transitional and temporary housing. It provides a structured, positive, and safe environment for an interim period for probationers. The vendors provide social support and program services in addition to housing. There's an average length of stay of 49 days and an average daily population of 137 offenders. The contract here was $2.3 million per year in the most recent year available. Finally, local reentry councils. These are local groups that coordinate resources trying to reduce barriers to reentry in the community. Services provided may include, but are not limited to, transportation, education and employment assistance, substance abuse referrals, and basic needs. $1.15 million in FY 22-23. Local reentry councils have been an area of interest for DAC and for the General Assembly for some time. And this map shows the current number of counties that have coverage from a local reentry council. There are plans to continue expanding this as resources allow. Wrapping up here with some of the recent legislative actions that have been taken with regard to DAC. In 2021, so a few items there included, aside from the salary schedules already mentioned, the funding for the long-term care facility at Central Prison Hospital of $7.2 million recurring, $50 million that was just a straight cash infusion for health services to try to help shore up that budget. $3.4 million in recurring operating costs for prison pharmacy, and 34 additional community corrections positions at a cost of $2.4 million recurring. In 2023, some of the items included the TASER program receiving $1.5 million recurring for support for those pieces of equipment, and Campbell University's Second Chance Initiative, which is an offender education program of $1 million recurring. So it's been a lot to cover of the largest agency in JPS. Total budget of some key takeaways here. The DAC supervises more than 100,000 offenders, representing 50% of the JPS budget, 60% of the full-time equivalent positions. Operating prisons is costly and labor-intensive. Community supervision supervises twice the number with fewer personnel. Offender health care continues to drive costs upward, and vacancy rates remain above 30% for correctional officers and for other positions inside the prisons. Mr. Chair, that is the end of my presentation.
Thank you, Mr. White. Representative Green.
Yes, sir. If could, I'd like to go back to medical for just a minute, and I'm just wondering, are any facilities, any of the individual facilities utilizing a contract medical service provider, or is it all in-house personnel?
DAC.
This is Dr. Campbell again, the Chief Medical Officer. So the personnel themselves, I know when we talked about the vacancy rate, what we're finding is with both with our credentialed providers and with our nursing staff, when we have prolonged vacancies, the requirement doesn't go away. We're still obligated to provide the care that's needed. So the way if we had to do that, accomplish that, is through contract. With our nurses, it's usually through the use of agency nurses, travel nurses. And for our credential providers, it's through the use of locums providers. So we have a contract for locums providers. We have several different vendors that are approved for that. And so for the in-house services, it's probably approximating 55-60% of our nursing and provider staff are now contract. We do utilize outside providers, so that's primarily going to be our specialty care providers. So we don't have oncologists on staff. We don't have surgeons on staff. So for those type of services, that is done through a contract mechanism with various hospital systems throughout the state.
Good. Representative Pirtle.
Thank you, Mr. Chair. My question, I guess, is for you, Mr. White. You spoke of the total lapse salary of about $269.7 million, of which about $10 million at the end of the day is reverted back. My question is, any of the eligible budget line item transfers, are they reoccurring, any of those reoccurring expenses?
Representative Purtle, make sure I understand your question. Are you saying, so lap salary cannot be, when it's moved over, that cannot be done on a recurring basis. And so the department,
I guess I'm talking
Yeah.
about any particular line item that it is used for. Is it a reoccurring expense? Any of those are reoccurring expense?
Representative Purtle, so yes, sir, but they are also variable. So, right, so overtime obviously is a recurring expense, but it varies. Pharmacy is a recurring expense, but the amount cost per year varies. I don't know if that gets to your question, but I don't believe there's anything that is, and we can look into this more, that is consistently or known to be in a non-variable way under budgeted at a recurring amount. But again, we can look into that more for you. Does that answer your question?
Yeah, we'll talk offline.
Okay, sounds good. Yes, sir.
Senator Daniel.
Thank you, Mr. Chair. Mark, if you could run back to slide 40, or up to slide 42. Just wanted to ask you about these averages. So it looks like, just if you're an employee that works closely with inmates, our vacancy rate is in the 35% range. But my question is about the statewide average. What departments are included or not included in the 20%? And could we get like a list by department, what their, and I mean like outside of JPS, what is AG's vacancy rate? Like are we driving the 20%? Is kind of where I'm getting at.
Senator Daniel, I would need to look into that more for you. The number came from OSHR, and so I don't have a list off the top of my head of exactly which agencies might have been excluded from that number, but we could definitely get that information for you. Yes, sir.
Representative Maury.
Thank you, Mr. Chair. Thank you, Mark. It's a great presentation. I have two separate issues or questions. One is a couple of years ago we went to the tablets for to receive mail, and I think part of the reason was to reduce any contraband coming in through the mail. Has that been effective, or any issues about that?
DAC.
Thank you. Brandy Sean Harris, Chief Deputy Secretary of Operations. It has helped. Those that are incarcerated has moved to different avenues. That's typically what happens. So we did very well with the electronic mail. It did reduce the amount of contraband coming in, and now they are utilizing legal mail. So we're working on changing that process as well.
Follow up.
Thank you. Legal mail to go to electronic mail? Is that what you mean?
No, we're just looking at a process where they can start, the attorneys can register, so we'll know what's coming directly from the attorney and what's being manipulated.
Great, thank you. One other question, if I may.
Yes, ma'am.
Nothing was in here about the SOAR program. And I know the SOAR program for sex offenders has been very popular and essential, and yet very limited. Is there any plan to expand the SOAR program?
DAC.
Justin Davis, Legislative Affairs Director for the department. Great question. Actually, we just hosted a tour with a senator on Friday who was very interested in expanding that program. Certainly, we're always interested to expand things that are successful. So happy to take anyone down there for a tour. Certainly take a look at it. That program started, I believe, in the early 90s and has been successful. However, it continues to still be the only one that we have in our system. So certainly look forward to any conversations going forward with it.
Thank you.
Yeah.
Representative Smith.
Thank you, Mr. Chair. And I guess I have more of a comment or observation. Could we go to slide 26? And then I'll also look at 24 and 25. I think on the House side, at least in my couple of terms here, there seems to be an appetite for enhancing penalties as a way to deter crime. And I'm not going to comment on the efficacy of that, and in fact, I voted for several of those bills. But I think the point that I can make is that if you look at these percentages, so what this chart tells me is that as the level of class of felony increases, the percentage rate of community supervision decreases, which tells me the active component increases. And then on slides 24 and 25, I'm just looking at these figures, it's certainly more expensive to house inmates that are serving an active sentence. And so I think that if we're going to enhance penalties and sentences on the front end, it might make some sense to look at the potential for reducing active sentences on the back end that in reality could be more narrowly tailored and individualized than a broad sentence enhancement. I think we could create some type of motion that a defendant could file and look at the age of the offense, their time in confinement, compliance with rules, vocational, educational training, that sort of thing, as well as getting in if there's a victim the other side of the state, making it pretty well rounded that would allow after they've served, and I'm just talking out loud, 75% of their active sentence, allowing them to transition into community service or supervision. I mean, I think a lot of this presentation has been fiscally related, and there's a lot of costs that seem to be increasing. This might be a way to, an effective way to ease some of that cost burden in an arena that's already very labor and cost intensive and strained. And so I just hope maybe we can have that conversation.
Representative Khan.
Thank you, Mr. Chair. Going back to slide 21, I just want to get a little clarification on the inmate litter program specifically. Two questions here. One, does that amount of funding satisfy the demand from our local sheriffs? And secondly, just to clarify what that funding is used for, I'm assuming that's for like the follow cars, porta potties, and any material operational costs that they would incur to comply with whatever the program is, the cleanup program.
Sure. Representative, I was just yesterday sent the dollar figure from the Sheriff's Association for how much has been spent to date of that $500,000, and my mind is blanking on that number at this moment. But I can tell you, and I think we will get it to you. And I think it was under half, I believe, at this point that's been spent of that $500,000. The way that program is structured, the funding is not earmarked specifically for items tied to that. It's just a flat increase in the reimbursement rate for the program, and so it's that ostensibly that is what it would be used for, would be to help operate the program and cover those higher expenses.
Okay, gotcha. That was my assumption. Just wanted to clarify.
Yes, sir.
Any further questions from the committee? Okay, Mr. White, thank you. As always, you do a great job, and we appreciate what you do to keep us straight. No further questions. Committee adjourned.